Well, Alan, when COVID first hit, we saw a whole family suffering from the deadly effects of this unknown killer. One Sunday dinner in March of 2020 infected 7 members of a single New Jersey family, killing 4 within just a week. Well, doctors know so much more now, yet one mystery still remains. 2 Michigan women, identical twins, making national headlines. Both had their bodies ravaged by COVID, but their outcomes were drastically different, and doctors went searching for the reason why. Their hair color may be the only way people tell Kelly and Kimberly Standard apart. These 36-year-old identical twins are inseparable and have been since they were babies. They live, play, and eat together. They only go their separate ways for work.
I work 2 jobs, so I have to be out.
Kelly works in childcare and retail. Early on during the pandemic, no masks or social distancing were required for her jobs. Kimberly works for Quicken Loans. They sent their employees home to work last year, February. By March, COVID symptoms hit them both with a vengeance, coughing and shortness of breath. Kelly, who has high blood pressure and diabetes, thought it was due to her asthma.
I was tired, a little dizzy.
Kimberly, who had no pre-existing health conditions, had the same symptoms.
So we decided to just go to the hospital to get checked.
They both had a fever higher than 102, and their oxygen levels were so low, the nurse wanted to know,
"How are you breathing?"
Both were admitted to the hospital. They received Tylenol for fever, hydroxychloroquine, antibiotics, and IV fluids. Kelly, with all of her pre-existing conditions, got better within a week. Kimberly, on the other hand, was rushed to intensive care and put on a ventilator. Then came word she had to be life-flighted from Ascension Providence Rochester Hospital to the University of Michigan in Ann Arbor.
I was like, oh my God, what's going on?
Kelly pleading just to say goodbye to her sister.
I rubbed her hand. She felt very stiff. I thought I was going to lose her.
Kimberly doesn't remember much, but knows she came close to dying.
I flatlined, they said.
Oh my God.
Yes, they said she flatlined when she was in the air.
Kimberly says she had to be resuscitated and upon landing was rushed to the ICU in a coma.
They had to give me anxiety because we never been this far apart.
Dr. Rashida Goyle of Ascension Providence Rochester Hospital, who helped treat the identical twins along with a health team, wanted to research why they would have such drastically different reactions. They studied their blood, and aside from Kimberly having fewer white blood cells, saw little difference.
If anyone gets infection, it's honestly up to fate. Like they can, completely recover, or they can have a very worse outcome requiring intubation.
Dr. Goyle says their treatment was the same. They both had low-grade fevers and had the same chest X-ray.
That's when I realized that prevention is actually better than cured.
After a month in the hospital, Kimberly finally returned home, unable to walk with weakened lungs and kidneys and a lingering cough. Today, they exercise more, eat healthier, and have a message for all who care to listen.
Be smart and do what you can to stay alive and keep the people around you alive.
These twins, now vaccinated, were featured on the cover of the New York Times and other national outlets like Newsy.
We want people to know how it feels to almost lose someone. If we do what we're supposed to do, we can fight this and win.
Kelly and Kimberly both see their doctor every month and continue to share their lessons by posting on Facebook. They're hoping people will learn from their emotional journey and get vaccinated and stay safe. Alan.
Yeah, Carolyn, the bottom line here really is it doesn't matter if you have diabetes, high blood pressure, or you're perfectly healthy. COVID does not pick and choose, and that's why it is so important that we continue to follow those health guidelines to get this virus under control.
Absolutely. That is the bottom line and the message they're leaving with us tonight.